Okay, so there's been a lot of talk about recurrent pregnancy loss and the new treatments that are coming out. What specifically do you use in your office, and what's been your experience with those treatments?
Well, the first thing is obviously taking a history on the patient, finding out how many losses they've had, and is it the first one? Are they coming to us after one loss, or are they coming to us after two losses, or is it more than that? And of course we got to look at the age of the patient, because the age of the patient really is a big determinant in terms of what's been going on here. So if the patient is 20 years old and had one loss, maybe we're not too concerned right away. But if the patient is over 40 and they had one loss, that's probably of concern, because we know that the major factor driving something like that, particularly in the older population, is chromosomal anomalies, because that would be the first thing we'd be looking for in somebody that's older. And somebody that's younger with one loss, we wouldn't necessarily target any kind of evaluation until they've had more than two losses.
Okay. And as far as patients go that are coming in for IVF, are they being told, you think, in your experience with other clinics, like to look at the immune system if they've had prior implantation failures, or is it pretty much just mostly based on egg quality still that they're being told that that's why it's not working?
Well, a lot of patients are always being told it's egg quality, or it's a bad cycle, or whatever it may be. Again, depending on what the doctor and the clinic feels about all that. But I'd say certainly we see, a referral base of patients that have had losses. And, again, looking at the age of the patient, and if they're coming to us, especially having losses of embryos that are chromosomally determined to be normal from the process called PGT, or pre-implantation genetic testing, where the embryos were actually tested and they've had two or more losses or implantation failure, that should spark some ideas in the doctor that, hey, this could be other factors besides chromosomal. So that's where they would need a more thorough
Mm.
investigation.